Уважаемые коллеги,
Dear colleagues, I would like to share with you a clinical case. Patient, a girl, 16 years of age, AML, M2 variant, condition after treatment based on a protocol, and allogenic transplantation of hematopoietic stem cells. During the consultation with the dietist, the girl was stated to have reduced appetite and the reduced content of protein in the diet, as well as a calorie intake below 50% of the individual need, a weight reduction by more than 4% versus baseline, as well as hypoalbuminemia and hypoproteinemia. This was an absolute indication for a nutritional support. I would like to remind you once again what kind of parameters were measured, such as height, weight, body mass index, upper arm circumference, and the triceps skin fold measurement. Here you see the primary nutritional status of the patient and the status prior to the nutritional support. As you see, the patient was admitted with normal nutritional status. Body mass index was 15 percentile, more than 15 percentile, which was indicative of a normal range. In a week after hospital admission, body mass index went down by more than 4%, and the patient had moderate malnutrition. Body mass index was 8.8. In 1 month, the loss of weight was more than 16% versus baseline, and the patient had already severe malnutrition, body mass index below 5 percentile. In this slide, we again list indications for active nutritional support or intervention: loss of body mass in a week by more than 2%, in a month by more than 5%, hyperproteinemia and hypoalbuminemia, as well as inability of the patient to take food adequately, and that when the patient either cannot or won't take food for some reasons or causes. In this slide, I show you the recommended duration of using this or that nasogastral tubes, and the longest placement is for the tubes of polyurethane up to 60 days. According to the international guidelines, when it is necessary to use nasogastral tube for longer than 6 weeks, a gastrostomy is recommended. In this slide, you see various stages of nutritional support in this patient. Primary consultation by a dietitian. 1 month after admission, we invited the dietitian because of the loss of weight and loss of appetite. And the first stage, the girl was given sipping of various formulas of various tastes, but the patient sipped very little and then refused to sip at all. And later on, we placed a nasogastral tube and began to feed the patient through it. In the first 2 months after the placement of the tube, a transcutaneous endoscopy gastrostomy was done. In this slide, you also see different stages of nutritional support and formulas used, with a brief characterization. As you see, quite varied formulas were used, but the girl tolerated well the standard frizapine formula, and so we fed the girl with it primarily. In this slide, you see the changes in the nutritional status on the course of this nutritional support. As you see, with the nasogastral tube for 2 months, the weight gain was more than 4 kilograms, while body mass index at that point in time was 18 percentile. That is, the girl had normal nutritional status. She managed to overcome the severe malnutrition. And after the gastric tube, a gastrostomy was placed, and she was fed through it. And again, the patient gained more than 8 kilograms, and the body mass index of the patient was 52.9 percentile, and that is a good nutritional status. With this nutritional support, still the appetite was very low, and less than 50% of food were taken voluntarily. And then the addition of food through gastrostoma allowed us to maintain the normal body weight on quite aggressive therapy and transplantation of hematopoietic stem cells. In this slide, you see a graphic representation of anthropometric measurements such as body mass index and mid-upper arm circumference. We see quite positive changes in line with the nutritional support. Currently, the girl has survived the major stages of her treatment, and soon she will be discharged with a normal nutritional status. Thank you for your attention.